This case study is about the health managers of Leicester City who worked in partnership with an arts organisation, with their local authority, with local schools and with local teenagers to develop a project which was about improving the messages and access to healthcare for teenage children.
The Leicester Teenage Pregnancy Partnership is very keen to try and do things differently. Otherwise, we will always continue to have high teenage pregnancy rates.
The agenda is in Leicester that we need to reduce the numbers of teenage conceptions.
50 teenagers per 1,000, that's 50 young women aged between 15 and 17 become pregnant each year in Leicester.
We needed to do something that was slightly more creative and innovative.
We decided that we would get the young people to develop their own messages for this resource around sex relationship education.
Teenagers learn in all sorts of different ways, but one of the key ways in which they learn is from each other.
We commissioned the Big Difference Company, so young people came together with a range of different artists and had a workshop.
And the young people all agreed that they wanted to work with the comedians, and that they also wanted to produce a comedy resource around sex relationship education.
The outcome of this exciting piece of work is that now we have a comedy DVD that's been performed, directed and engaged the young people in the production.
Do they? Yeah, and guys can get pregnant as well. Are you serious? Yeah. Is that what they mean by oral sex? Yeah, maybe, yeah. Ask your father. No, don't ask your father.
Comedy is not a serious thing, but it can be used very effectively to deliver serious messages.
Most young people are very nervous about talking about the subject and their feelings, and they're not sure how they feel about the subject either. There's a lot of embarrassment that's in the room, and I think to break the tension, comedy is absolutely the right vehicle to do it.
But don't be embarrassed about being embarrassed. Wear your embarrassment with pride.
The whole brief is that the comedy is the kid's own creation from the very idea of the first sketch to the finished performance. So I'm there as a guide really through all these different ways of doing comedy.
We gave the young people free rein to develop ideas for comedy sketches. It was then up to us to support them through the process of making them into a product that was going to be usable.
Come homework.
We'd all get together and we'd all talk about what we know, and we'd all combine each other's ideas, and we'd pick out serious subjects, and then we'd all try and link jokes and stuff to it.
We need to make it as funny as it is serious, and that bit's quite difficult. Sometimes we're a bit serious, sometimes we're a bit funny.
We want it to be used in schools as part of sex relationship education. We can also see potential for it being used in terms of teaching other health professionals.
The process by which this works, the way I see it, is that it's a partnership between you as a comedian or artist, the kids that are doing the comedy and the filming, the filmmaker, the sexual health practitioners, the professionals, and the teaching staff. And what happens is you all come together and bring something to the table, which means that you all benefit from each other's skills. And it means that it's almost like between you, you're one decent, well-integrated human being.
I think arts and health works best when it's about delivering messages. It's about delivering messages in a different and accessible way. It's about taking risk, it's about being exciting, it's about having some energy around what you're doing.
To improve our services, we've got to work together. We've got to be innovative in the way we approach things. We've got to think creatively about what's out there and use it to its best advantage.
If you always do what you've always done, then you'll always get what you always got. And I think that with some of the things that haven't changed in Leicester over a number of years, I think that there is an appetite for trying to do things differently that might really make a difference.
Managers in Partnership supports innovation and partnership working in healthcare. Where something works well, we want to tell people about it so the public everywhere can benefit.